Hi, everybody. Welcome back. Dr. Stephanie Waite here. I am a licensed professional counselor practicing in Sherman, Texas with Texoma Specialty Counseling. I specialize in eating disorders, sexual trauma, and anxiety. Now, you might have heard those three things and thought, well, those are some sort of very maybe random things to specialize in, but anxiety, trauma, as obsessive compulsive disorder, depression, and eating disorders are actually all very much related. So today I'm going to talk a little bit about that. Can you have anxiety and an eating disorder? Yep. Can you have depression and an eating disorder? Also, yes. Can you have obsessive compulsive disorder or trauma and also have an eating disorder? Yes. If you have an eating disorder, are you going to have depression, anxiety, OCD, or trauma? Not necessarily. And if you do struggle with anxiety, again, trauma, OCD, or depression, you're not going to necessarily have an eating disorder. All of that is to say is that one doesn't cause the other. So an eating disorder doesn't cause anxiety. Anxiety doesn't cause an eating disorder. But that we see eating disorders and things like anxiety, depression, PTSD, and OCD are very related. Why is that? Well, there could be lots of reasons why that is. Maybe it's your personality type, but really what I think happens is you had something that triggered something in your brain, and here you are with these symptoms of an eating disorder, symptoms of anxiety, symptoms of depression, and so on and so forth. Your brain is chemically not where it should be, and it's causing you to have these upset feelings. It's causing you to have these symptoms. One of the reasons that eating disorders are such a specialization and not just anyone can see someone with an eating disorder is because they're very complex issues. And the thing that I think to keep in mind, or the thing that has helped me help my individuals with eating disorders, is that your eating disorder is there for a reason. It's serving a purpose. Of course, it hurts and it causes all this upset, and you don't like your eating disorder. You don't like the living hell that you're living in, but it's protecting you from something. You are getting something out of your eating disorder. Now, I want to put a warning label there and say no one wants to be disordered eating. It sucks. It's hell. It's shitty. It's uncomfortable. So your loved one or you aren't saying, man, this is the best thing ever. I love this eating disorder. No. But that what happens in a lot of cases is that feelings become very, very challenging and hard to deal with. Things seem too upsetting and overwhelming. And this eating disorder becomes a way of helping you manage those feelings. It's a way of feeling. It's a way to sort of numb yourself. It's a way to avoid feeling certain things. And it again depends on, do you have anorexia? Because there's certain coping mechanisms associated with anorexia. Do you have bulimia? Because that's serving some sort of coping mechanism. So it's not just as simple as, hey, eat your food, just start eating. Hey, just love your body and see yourself the way that you are in the mirror. It's way more complicated than that. It's very hard because these behaviors are helping you deal with anxiety. It's helping you deal with depression. It's helping you deal with a trauma. It's just not obviously the most healthy way to deal with these things. And all of these issues are very complicated, overwhelming things. But what's really wonderful and what I hope that you're learning from watching these videos is that there's help. You don't have to live like this alone. You don't have to suffer. Your loved one doesn't have to suffer. There's a way to learn to control anxiety, depression, OCD, trauma, and an eating disorder. You can get well, you can recover, and there are lots of wonderful people out there to help you do those things. I'm available to help you do some of those things if you're interested. So I'm going to have my contact information here. Always ask any questions. Always provide any feedback. Please share this video if you think it will be helpful for someone. And as always, take care. See you next time. Bye.